Hi, everyone, and welcome. If you're new here, I am April Blackford, and I am a functional diagnostic nutrition practitioner and founder of Instill Wellness and Nutrition. I work with women who are navigating perimenopause, hormonal chaos, and gut issues that just won't quit, especially when you've tried everything and nothing has worked. I help women get to the root cause of what's going on in their bodies so that they can feel like themselves again, not just slapped with another prescription or told it's just your age. Today, we're diving into a topic I get asked about all the time, and that is hormone testing. Because let's be real, if you're bloated, you're tired, you're gaining weight for no reason, snappy at your partner, hello, rage, waking up at 3 a.m. every night, or feeling like your body is just straight up betraying you, something's going on hormonally. And yet, many of you have had labs done and been told everything looks normal. So, let's talk about why that is and how to actually get answers from hormone testing that reflects what you're really feeling. So, first, let's talk about why testing matters. So, most conventional hormone testing is done at the wrong time, is missing key markers, and is focused on disease diagnosis, not actual dysfunction. So you need testing that matches your symptoms and looks at your body like a system, not a set of isolated lab values. Now, let's dive into the different types of hormone testing. So let's break them down, and each has its strengths and its role depending on your symptoms and overall situation. So, the first method that we're going to talk about is blood testing, which is also known as serum testing. Now, how does this work? You go to a lab for a blood draw, and this test is best suited for checking hormone levels in circulation like estradiol, FSH, which is the follicle stimulating hormone, LH, which is the luteinizing hormone, thyroid hormones, and testosterone. Now, it's also beneficial for evaluating HRT dosages in women on hormone therapy. And for those of you that don't realize what HRT stands for, that stands for hormone replacement therapy. Um, it's also best suited specifically for men, as serum testing is going to be the most accurate for testing for total and free testosterone. So kind of keep that in mind. Now, the limitations with serum testing is it's a single snapshot in time. Hormones fluctuate throughout the day, especially cortisol and progesterone. It does not show how you're metabolizing or detoxifying hormones, specifically like estrogen. Also, progesterone testing in blood is especially unreliable if not timed correctly. So keep that in mind. Now, an important note for cycling women. And I see this all the time. I have conversations on a daily basis. I see this in some local groups that I'm in. Women are getting hormone tested and they are not getting it tested at the optimal time. So, the optimal time to test your hormones, if you are still cycling, is going to be 5 to 7 days after ovulation. And that is when progesterone and estrogen should be peaking. So, they're going to be at their highest. Now, if you're not sure when you ovulate, so like I say, like you have irregular menstrual cycles, um, your 1 month is 21 days, the next month's 28 days, and it's unreliable, then you can pick up some inexpensive ovulation predictor strips, and they'll tell you when your luteinizing hormone peaks, which usually happens 24 hours before ovulation. So you can use the test strips, know exactly when to test. Now, if your cycle is irregular and you're not ovulating, hormone testing can still be done, but it's interpreted differently based on that context. So, and that's the same specifically for like a postmenopausal female who is not getting a cycle, or she's past that stage. Now, the second method is saliva testing. Now, how this works, just like it sounds, you collect multiple saliva samples over 24 hours. This is best for evaluating free bioavailable hormones like estrogen, progesterone, testosterone, and cortisol. It's especially beneficial for tracking cortisol rhythms across the day. And this can be especially useful if stress, fatigue, or burnout is an issue. So this can determine if HPA axis dysfunction is present. Now, the limitations here is it's less accurate in postmenopausal women or for those on hormone replacement. And also, it can be sensitive to sample contamination from eating, drinking, brushing your teeth. So, kind of keep that in mind. Now, saliva is a step above basic blood work, but often replaced now by more comprehensive tests like the Dutch test. Then we have the third test, which is the Dutch test. And Dutch test stands for dried urine test for comprehensive hormones. How it works, you collect urine on filter paper 4 times throughout the day. Now, it is best for looking at hormone levels plus metabolism of hormones plus detoxification. It specifically looks at estrogen metabolites, and this is critical if you've got signs of estrogen dominance like heavy periods, fibroids, or weight gain, specifically around the hip and thigh areas, which is common for perimenopausal women. It also looks at androgens like testosterone and DHEA, which can be great for looking at PCOS patterns. So, if you're someone who has PCOS or has struggled with PCOS, that can be good for looking at those patterns. And also, in addition, it does look at cortisol. So, not only does it look at cortisol, it looks at both the total output and the circadian rhythm of cortisol. So, a little bit more detailed there. And also, kind of a bonus, which I look at this as a bonus, it has organic acids like melatonin and B12 markers, and a couple of other additional ones that are also included, which I think is super beneficial. You get like a big bang for your buck there. Now, what are the limitations with the Dutch tests? It is an investment, and usually it's not covered by regular insurance. It does require interpretation, so it is not a DIY test, but it can be amazing when paired with practitioner support. So, if you're looking for a root cause clarity and you're dealing with hormone plus gut issues plus stress overload, this is hands down going to be the most comprehensive test I use in my practice. Now, lastly, there's options for combo testing. Sometimes I'll combine tests. So, for example, sometimes I'll use serum testing and Dutch if someone's already on HRT or we're cross checking thyroid, insulin, fasting glucose alongside hormones. So if I need, a snapshot of like multiple markers in one, I'll combine the two. Now, which testing is right for you? Let's make it simple. If you're cycling and you want a big picture look at your hormones plus stress plus detox capacity, go with the Dutch Complete, but make sure it's timed properly in your cycle. If you're not cycling or postmenopausal, Dutch testing can still give incredibly valuable information, and there's no need to time it around your cycle. If you're male and you suspect testosterone issues, blood serum testing is going to be your gold standard. If you're super stressed, wired, tired, or running on fumes, then you want to do saliva or Dutch testing to assess the cortisol rhythm. That's going to be a must because it's both of those are going to look at the 4-point cortisol reading. And if your doctor told you that your labs look fine, but yet you still feel like crap, then you probably need a functional test that dives deeper than conventional labs do. So, okay, so a reminder, timing matters. So for cycling women, again, this is huge. You want to test your hormones 5 to 7 days after ovulation. That is when progesterone and estrogen are going to be at its peak, which is going to give us a clearest picture of how balanced your estrogen to progesterone ratio is. Because you'll get a measurement of estrogen and you'll get a measurement of progesterone, and one might be low, vice versa. But it's the ratio of the two that matters the most. And keep in mind that, and I see this all the time, or I've interpreted regular labs for clients all the time that they may have had their hormones tested and estrogen is in normal range, progesterone is low, but yet they're dealing with all these symptoms that are textbook excess estrogen. And keep in mind that when that ratio is off, so if progesterone is low and estrogen is in that normal range for where you are, where you are, like based on your age and where you're at in regards to menopause, then estrogen will still be considered, you'll still be considered estrogen dominant because of that ratio. So you still will have those symptoms. So if your cycle's irregular, again, you can use ovulation test strips to find your luteinizing hormone surge and then test 5 to 6 days after that. If you're not cycling at all, test anytime. Now, what can you do with the information? This is where most people get stuck. They get labs and they don't know what to do next. So testing is just the starting point. I use it to match your symptoms with data. Use it to uncover hidden imbalances like cortisol burnout, estrogen dominance, and androgen excess. And then I build a personalized plan with nutrition, stress support, supplements if needed, and lifestyle tweaks that actually make a difference. So, knowing your hormone numbers can give you so much power over how you feel every day. Whether you're trying to lose weight, sleep through the night, feel more like yourself again, or just understand what the heck is happening in your body, the right test can be a total game changer. So, if you're tired of guessing and you want real answers, this is where we start. Drop your questions below or DM me if you're curious about getting a Dutch test or a functional lab panel done as part of my one-on-one coaching package. We'll find the test that's right for you based on your symptoms, cycle, and goals. And that is it for today. And I will see you next time.